Okay, lock in because today is all about glow. When I'm talking with my cosmetic patients, one of the biggest skincare goals that they have is brighter, smoother skin. And whether you have old acne marks, melasma, sunspots, hyperpigmentation is something that so many of us deal with, including myself. I've had melasma for over 10 years. And when you have hyperpigmentation, it's always going to limit your ability to have maximum glow. It's been quite a while since I have walked you through an entire hyperpigmentation routine. So that is what we are doing today. I'm so excited. I've got great product recommendations, but also little tips and tricks that I think a lot of people don't think about that could be impeding your success when it comes to treating your hyperpigmentation and your dull skin. So we're going to get into it. If you're new here, hi. I'm Dr. Sam Ellis. I'm a board-certified dermatologist. Welcome to this community. On this channel, I break down skincare, hair care, nail care, aesthetic treatments from the perspective of a dermatologist so that you can understand what works, what's worth your money, and how to build routines that make sense for your life. So, if you're into science-based skincare and you want highly vetted product recommendations from a beauty and skincare junkie, but also expert, you are in the right place. Do not forget to like this video and subscribe to the channel. I post every single week. Also, this video has a collaboration with Dermtour. You guys know I love Dermtour. It's where I buy so much of my skincare and hair care. I recommend products from them all the time. And I love them because they've not only curated a really good product selection, but they also tend to run discounts and have amazing sales. And you guys know you can always use my code to get a discount on your product. So, I'll put more details in the description box. Okay, let's get into the skincare routine. This is going to be a morning skincare routine. I absolutely will be doing a nighttime skincare routine as well for hyperpigmentation. So, make sure you are following or subscribed to the channel so you do not miss when that comes out as well. But I feel like it's a natural place to start in the morning. How you set your skin up for success in terms of fighting off hyperpigmentation, blocking it, treating hyperpigmentation is then going to make your nighttime skincare routine that much more effective. First step is optional, which cleanser is going to be a surprise to some of you, but not for those of you who've been following this channel, which is cleansing your skin. Not everyone needs a morning cleanse, especially if your skin tends to be really sensitive, dry, or tight. The natural oils that you produce overnight are actually going to be beneficial for your skin. So, you don't necessarily want to take those away with a cleanser. However, if your skin leans oily or you use really thick creams overnight and you feel like there's some residual on your skin in the morning, cleansing those away can really make your skin just feel better and is going to help your skin accept any of the products that we are going to put on in the subsequent parts of this routine. Even though I would say my skin leans sensitive, I have been enjoying a morning cleanse. But I think because I'm using such a gentle cleanser, my prequel cleanser, which is 50% glycerin, it's just a very non-stripping, hydrating cleanser. I find it's a good balance of setting my skin up for success, getting that refresh in the morning, but not making my skin feel dry or tight. So, it doesn't necessarily have to be my prequel cleanser, but a gentle cleanser that feels good on your skin if you're going to use one. Once your skin is clean, we're then thinking about building a skincare regimen where every single product is intentional in its ability to fight hyperpigmentation through some mechanism. Now, if you have really mild hyperpigmentation, you may not need to do this. But what I have found as a dermatologist is that hyperpigmentation is incredibly stubborn, and sometimes it takes things coming at the hyperpigmentation from multiple angles. We kind of call this the kitchen sink approach to get the best results. This is going to be particularly true if you're taking a break from prescription hyperpigmentation treatments. So, for example, if you've been prescribed hydroquinone, you know that you cannot be on hydroquinone indefinitely. So, this would be a routine that you could use while you're on hydroquinone, but also use in between when you're on your hydroquinone breaks to help you maintain your progress. 1 to 2 times a week, depending on what your skin can tolerate, but also the products that you're using, which I'll get to in a second. I do recommend some form of alpha-hydroxy acid exfoliation. Alpha-hydroxy acids are things like glycolic, lactic, mandelic acid. I have a whole AHA video dedicated to breaking down the alpha-hydroxy acids for you. But the reason they work well for hyperpigmentation is because they help break apart those very surface skin cells and help with skin cell turnover. When you have hyperpigmentation, some of the surface cells are pigmented. And so when you get those to slough off more readily, it's going to reveal brighter skin underneath, and it's going to allow your products that you're putting on later in your routine to penetrate better. I think that one of the best alpha hydroxy peeling products that exists, and it has been on the market for a long time, are the Dr. Dennis Gross Peel Pads. They come as a two-step system. This is sort of their original strength. They also have, I think, a stronger strength, and then they have a more gentle version, but the stronger one has 7 acids. This one has 5 acids. Their more gentle version has 3 acids. So you could kind of cater it based on what your skin can tolerate. And the first step has all the acids which you put on, you let it dry down, and then you have a neutralizing step with a bunch of antioxidants, which is also a really helpful thing when it comes to fighting hyperpigmentation because oxidative stress breeds melanogenesis. It makes you produce pigment. And so when you can stop that process in its tracks by both exfoliating and then calming the skin, you're going to be in a really good spot. I find these incredibly convenient, very satisfying to use. I love that there's different strengths, so it caters to a lot of different skin types and tolerances. But the other thing I like about this is there's quite a bit of product. So when you're swiping it over your face, there's leftover juice in there. And I will always bring that onto my neck, my décolleté, the back of my hands. If you struggle with hyperpigmentation in other body sites like armpits, groin, elbows, knees, absolutely take whatever is left over on that pad and put it on that spot as well. These are not the cheapest thing you will ever purchase, but they are so good. I never worry about recommending these because they're amazing and everyone loves them. Now, some of you might have heard to not use alpha hydroxy acids in the morning because alpha hydroxy acids make you more sun sensitive, and only part of that is true. Yes, alpha hydroxy acids can photosensitize you, making you more sun sensitive. However, whether or not you use your alpha hydroxy acid in the morning or at night has zero bearing on that because that increased sun sensitivity after you use an AHA lasts for about a week. So whether you use it in the morning or at night makes no difference. The reason I like to use it in the morning is because I tend to use other potentially irritating skincare activives in my nighttime skincare routine like hydroquinone, like a retinoid. So I like to separate them out to reduce skin irritation potential. It also means that if you live in a really sunny place, and this is key, you spend a ton of time outside, alpha hydroxy acids might not make sense in your routine. But I live in a really sunny place. I live in Northern California. I still use an alpha hydroxy acid in my routine because the vast majority of my time is spent indoors. I'm well sun protected, but I do stop my alpha hydroxy acids like a week before a really sunny vacation when I'm going to have way more sun exposure than average. If you use this in the morning, the good news is you get to skip your antioxidant because there are so many amazing antioxidants in this product. But if it's a day that we're not using this, which is going to be most days of the week, the next step in the routine after cleansing would be application of an antioxidant. Antioxidants can be incredibly helpful not only in anti-aging routines, but also in hyperpigmentation skincare routines because antioxidants neutralize free radicals. And free radicals are problematic molecules that get generated from normal cellular metabolism, but also things like UV radiation and pollution. And not only do they cause premature skin aging, but they also can cause unnecessary pigment production. So, anything we can be doing with antioxidant protection to keep those free radicals limited in our skin is not only going to help our skin be healthier, but also help it be brighter and more clear. The gold standard antioxidant is vitamin C. It's why SkinCeuticals CE Furoic is so renowned because they did the initial pioneering research to determine that L-ascorbic acid, that specific form of vitamin C, when formulated as they have formulated, it really helps with things like brightening the skin, but also protecting against things like collagen breakdown. It's the whole reason why when I made an antioxidant for my brand Prequel, I also wanted to use L-ascorbic acid, and that's what's in our Lucent C serum. However, as a dermatologist who treats literally thousands of patients a year, I also recognize that not everyone can tolerate vitamin C. It may cause irritation for some people, flare their perioral dermatitis, give them acne breakouts. So I wanted to give you an alternative antioxidant that I find very well tolerated and also incredibly effective. It's this little guy right here, the Medicaid-Oxy or peptides. This product is genius. I feel like I haven't talked about it enough, and it deserves more attention. So this has 1% oxyresveratrol, which is a very potent yet gentle antioxidant that has all of the beneficial antioxidant effects that I talked about earlier, but it also has the ability to inhibit tyrosines, which is an enzyme in our skin that produces melanin, that produces pigment. So when you block that enzyme from functioning, and it's how a lot of the products I'm going to talk about in today's visit work, you reduce that excess pigment formation. In addition to the oxyresveratrol, this also has tetrapeptide 30, which is a peptide that also blocks tyrosines. So, specifically for people who have hyperpigmentation, and especially for those who are too sensitive to use vitamin C, which is also great for hyperpigmentation, I highly recommend you try this. I also feel like I should say, since this bottle looks incredibly small, that one package of this comes with 2 bottles, and you activate them separately so that you go through one entire bottle, and then you activate the second bottle, because the big issue with antioxidants is they can be quite unstable. Also, Medik8 has done a very smart thing here, and they have you go through half the product at once, and then you can activate the other half of the product, so that what you're using is always going to be in its most efficacious form. And if you have a vitamin C that you love and use successfully, don't stop it for the sake of this. I would just put this in your nighttime skincare routine instead. After you cleanse your face at night, put this on, and then proceed with the rest of your routine. After your antioxidant is on, this would be the point in my skincare routine where I would put on your prescription products. Now, I'm not your doctor, so always check with them first, but for example, I prescribe a lot of 15 or 20% azelaic acid for my patients who struggle with melasma or other forms of azelaic acid hyperpigmentation. And azelaic acid can be used in a nighttime routine, but again, I don't love to stack up acids and retinoids in the evening. So, usually I'm reserving that for the evening, and I have them use their azelaic acid during the day. So, if you're wondering where to put your prescriptions, this would kind of be a nice place to do this. If you like to use your hydroquinone in the morning, another nice place to put this. And then we will move on with other treatments that are not prescription. And if you're like, whoa, I like the idea of azelaic acid. Say more. I don't have a prescription for it. 1. You can talk to your provider about getting a prescription. 2. You could try an over-the-counter version, like a 10% azelaic acid. Thorium has a great azelaic acid emulsion that layers very beautifully with other products and is incredibly affordable. Azelaic acid is really nice because it inhibits excess pigment production. It's an antioxidant. It helps smooth the skin. And for people who have easily irritated skin, for people who are pregnant, azelaic acid is an incredible option. Also, if you follow me on Instagram, you know I have a small obsession with the Allies of Skin Azelaic and KIC acid clarifying serum. That is not necessarily marketed as a hyperpigmentation serum, but it has azelaic acid in it, as well as some other pigment brighteners. I just feel like I talk about it all the time, so I didn't want to hit you over the head with it. But that is another fantastic multifaceted product. So put on that azelaic acid if it speaks to you. The other product I recommend a lot to my patients, and what I would layer in this routine, is the Allies of Skin Tranexamic and Arbutin Advanced Brightening Serum. This is a very good hyperpigmentation serum. And yes, it is on the pricier side, but when I recommend products that tend to be more expensive, 1, I try to recommend them when you can get a discount. But 2, it's not just because they're expensive. It's because they tend to have multiple efficacious ingredients at efficacious levels. There are certain products that have a long list of ingredients, but nothing's really at like an efficacious level, or it has so many ingredients in it. But now that I have my own brand, I realize that some ingredients can't really work well together. So it looks nice on a label, but in the actual formula, only 2 of those ingredients are actually going to be effective. And I feel like Allies of Skin just does a really good job at balancing their products, but they're not putting too much in. And they're really being mindful of the pH of the products and the appropriate efficacy levels. And this one is really fantastic, and people see great results. This formula has 2% alpha-arbutin, which is a really strong pigment inhibitor. I love to see it in a hyperpigmentation product. It's also a precursor to hydroquinone. And if you're not familiar with hydroquinone, if I know I've mentioned it a few times in this video, it is the gold standard topical for treating any form of hyperpigmentation. It is prescription only within the United States, and it's fantastic. It can work really well, specifically when you combine it with a mild anti-inflammatory and with tinoin. However, it can be too irritating for some people. And so having a precursor of hydroquinone in the form of alpha or butane allows you to have a lot of those similar pigment blocking abilities without the irritation, without the big hit of hydroquinone to your skin. It also has 3% acid in it, which can be helpful for pigmentation as well, particularly through an anti-inflammatory pathway. I use a lot of oral train acid in my office for the treatment of melasma, but there is some data to suggest that in its topical form, it can also be effective. I find it hit or miss depending on the patient. This also has a brightening licorice root extract and other pigmentation fighters as well. So, just a jam-packed product, but I love it so much because it's incredibly gentle on the skin. And because so many brightening and hyperpigmentation products can be slightly irritating to the skin, having things that are gentle in your routine, that are not going to cause excessive inflammation, are so key. So, this is a big winner for me. Once you have all your treatments on, and I will say I think it's nice to wait at least like 30 to 60 seconds in between these steps. Your routine from start to finish should not take more than 10 minutes, but it should probably take more than 2 minutes if it's being very targeted at hyperpigmentation. Next steps are moisturizer and sunscreen. Moisturizer is optional moisturizer plus sunscreen depending on how much hydration your skin needs and depending how many treatments you layered underneath, because things like azelaic acid and the serum I just talked about are both hydrating. So, you might not feel like you need a moisturizer. But sunscreen is like, don't even think about stepping outside without that on. The moisturizer I use by far and away the most these days is my Prequel half and half fluid moisturizer. I mean, I'm almost done with this bottle. It is such a good lightweight moisturizer. I just had a patient in yesterday, actually, who works for a very well-known skincare brand, and she's like, I work in this space and I cannot get enough of this. And I agree. It's a fantastic lightweight moisturizer, and if you want to be able to layer lots of products but you still need a moisturizer, this allows you to get that extra boost of moisture without feeling heavy. So, I love this. Of course, moisturizer is optional. If you have a moisturizer you love, go for it. But if you've been looking for something that gives a little boost to your skin, but doesn't mess with all the other products you've layered underneath it, and still sits well under makeup and sunscreen and all those things, may I suggest? And now we arrive at sunscreen. And do not click out of this video if you've made it this far. You might be thinking, oh, sunscreen. Okay, I got the rest. No. Because this is where people make the biggest mistakes. If you do nothing else for your hyperpigmentation, you don't use an antioxidant. You don't use any brightening serums. You don't use any prescription products. At the very least, use sunscreen. If you do nothing else, sunscreen will still help your hyperpigmentation. However, you must put the correct amount of sunscreen on. And how much sunscreen your face needs depends on the size of your face. But you want a strong coating. For most people, that is going to be a juicy fat line of sunscreen on 2 fingers. So if you have a really fluid liquidy sunscreen, go in with it. I think 4 fingers of a really light fluid sunscreen or 2 of a thicker, creamier sunscreen are really going to get you where you need to go. I like to apply my sunscreen in 2 layers. And I'll show you what I do. In almost every case of sunscreen application, granted there are exceptions, I will recommend that you apply a non-tinted or untinted sunscreen first. And I will explain this. I love my Beauty of Cho sunscreen. This is a Korean sunscreen, not the American version. This is from overseas. The reason I like Korean sunscreens so much is 1, they have advanced UVA filters. So filters that we don't have access to in the United States that are superior, and if you deal with hyperpigmentation, you're going to be more sensitive to UV than your average person. The other reason I like these products is a lot of Korean skincare routines are 10 steps long. And so they design their sunscreen to layer well over a lot of products and not feel heavy. Yes, there are American sunscreens that I absolutely adore, European versions as well, but this is one that I reach for a lot. I have tons of other Korean sunscreen recs. So, you can check out my YouTube for other versions. But what I will do with this is I will take 1 finger length, I will apply it, and then I will take a 2nd finger length and apply it. And the reason I do it in 2 layers is because I find that if you do 2 at once, you're just doing a lot of smearing. And I feel like a lot of it ends up on your hands, or just mushed around. And so I feel like you get a much better coating when you go in with 2 layers. Now, for those of you who want to use a tinted sunscreen, let's strategize. I know a lot of you like tinted sunscreens because you get a bit of a makeup effect and you're getting your sun protection. However, I find that most tinted sunscreens are so pigmented that if you were to apply 2 full finger lengths of them, you would look like a freaking clown. And so the key here is making sure that you are actually applying enough sunscreen to get adequate protection. So what I would recommend is you do like 1 and 1/2 finger lengths of your untinted sunscreen. Let that dry down, and then do like 1/2 a finger length of your tinted sunscreen. So you still get that beautiful makeup effect, and you're supporting the sun protection underneath, but you are not underapplying sun protection overall. The other thing is tinted sunscreens can be quite helpful for people who have hyperpigmentation and who have medium to deep skin tones because they have something called iron oxides in them. And iron oxides are what give tinted sunscreens their pigment. It's the same things that give foundation its pigment. And they help block blue light. Blue light mostly comes from the sun. I know people make us worried about the blue light that comes from our laptops or our phones. That is negligible. You don't have to worry about that blue light and that being problematic. But blue light from the sun, only if you have a medium to deep skin tone, can promote hyperpigmentation. So I always recommend to my patients who have those deeper skin tones to wear sunscreen and then either wear a tinted sunscreen or foundation. Those work the same. I keep waving this around and not telling you what it is. So, this is the Color Science Face Shield Flex. I think this is such an incredible tinted sunscreen. It comes in, I think, 5 shades. Now, I have always mixed the fair and the medium shades because I change colors a little bit if I have a fake tan. If I have accidentally a little bit of a real tan, I like to make sure I can get a perfect match. So I do purchase it in 2 colors and mix and match. And it is okay. They have said you can mix their formulas together. In general, you should not mix your sunscreens together, especially if they're from different brands and they're different formulas, but these you can mix. They do have a light version as well, which sits right in between, which is going to be my exact shade sometimes, but I still like to have both and really get that perfect shade match. So, there are a lot of days that I wear 0 foundation and 0 concealer. This is often when I'm in clinic and I will just have my normal sunscreen on, and then just a little dab of this, understanding that I am not getting a lot of SPF protection from this, but I am getting some blue light protection, which is irrelevant for me but would be relevant if you have a deeper skin tone. But more so, it's just giving like a really nice makeup effect. I don't know if you have tried these before, but they are fantastic. Or, if you have a tinted sunscreen that you love, let us know in the comments and let us know kind of what your skin tone is, or like what foundation shade you wear, so that people can understand, cause that's the other issue with tinted sunscreens. They don't match all tones. So, that is my updated dermatologist-approved morning routine for hyperpigmentation and glow. I hope you learned something. If there are any little tips or tricks that really resonated with you, or if there's any products that you're interested in trying, let me know in the comments. Also, if you've tried anything that has worked super well for your hyperpigmentation, let us know. Please share the love. I love seeing you guys bring so much positivity and love to the comment section. I go and read every single thing. Thank you so much for being here. Do not forget to subscribe so you don't miss my nighttime hyperpigmentation skincare routine. And I will catch you next time.